We spend 17% of the gross domestic product in the United States on healthcare. The closest competitor globally is the Japanese. They spend about 10%. The European Union, Canada, they all spend significantly less than that. So when you hear about the bend in the curve, that's what's most important from a fiscal standpoint about changing healthcare in the United States. The bend in the curve is if you look at retiree healthcare costs on the County Board of Supervisors, we have a problem because retiree healthcare costs, as a big employer, they're going like this. And the reason they're going up is because healthcare costs for everybody are going up dramatically. So the bend in the curve is, as we start to look at actuarial reports, is if we can do healthcare reform that can cut some of the waste out of the existing system and introduce more competition, it starts to go like this. And this is also, you can get this from the Congressional Budget Office if you want to read lots and lots of paper on it, but the Congressional Budget Office is a nonpartisan part of the House of Representatives in the U.S. Senate, and I think they do a very good job of explaining where the cost savings will be in the long term. So the President's idea, and the bill has come out of Congressman Miller's committee and has come out of 2 other committees on the House side, basically creates a public option. And it's interesting listening to people who are critical of it being concerned about a public option bringing the cost of healthcare down. Usually we hear from conservative elements of the electorate that anything that's run by the government is going to be expensive and inefficient. And here the same people are saying, well, we're worried about a public option because it'll drive costs down and be unfair competition. I have my concerns about the public option. My concerns are mostly that we have to get a pool of people in the public option to make it work. So for instance, in this, we really do have a public option right now. And in this county, we have a very vibrant public option. I am a member of the Contra Costa County Health Plan. And my sons and I have gotten medical services from the county hospital and the county clinics. We go to the Concord Clinic on Little Pass Road. But I'm paying, obviously I was paying in. So I pay in more than I take out in services, fortunately, because I haven't had major medical problems. But for people who do pay into the Contra Costa Health Plan, they are basically subsidizing indigent care and very poor people. So that's in a good county health plan in California, that's what you're trying to do. You're trying to give good health care for people who can't afford any health care, because that's where you go if you have no health insurance. You go to the county emergency room. And then the county has partnerships with John Muir and Kaiser, and they're all different contractually. So basically, a public health plan in the national idea from President Obama will be similar to that, but we have to get enough young people in particular into the plan and paying so that it can cover its costs. And then if that happens, in a perfect world, the competition induced by that will have other health insurers coming down because you will want to go to a program that provides good health care and does it in a way that's cost effective for you. That 17% number in terms of the gross domestic product, our health care has been eating away at our wages and our savings for some time. So economists will tell you that there are 5 fixed costs in every American household, regardless of age, one being that I will explain, obviously less for seniors. But those 5 fixed costs are taxes, health care, transportation, housing, and education. Education includes child care, everything for when you're parents and raising kids. Of those 5 things, 30 years ago, they were about 25 cents on the dollar in the United States of America. They are now about 65 to 70 cents on the dollar. And where of the 5 things that have gone up the most, taxes have gone up the least. The other 4 have gone up exponentially. So they've eaten away at our disposable income. And that's the problem with healthcare that we're trying to get control over. We cannot allow for the cost of healthcare, just like the cost of housing or the cost of transportation, to outstrip wages because it eats away disposable income, gives people less freedom, less opportunity to decide they're going to go out to eat at a restaurant, go out to a movie, take a vacation, because you're just dealing with that last 25 cents on the dollar that you have. We all grew up in a world where most middle American households had a lot of purchasing power. I'll end on the economic side of this with when we were kids, there was one income, one household in most households in the United States dealing with those fixed costs. It now takes 2 incomes to earn 75% of the purchasing power than when we were kids. So all of this in the context of, and that part of the partnership, part of the synergy with those fixed costs. So we can't allow this to continue as a society. It's eroding Americans' greatness to have these costs continue to go up where our wages aren't matching them. And in the 50s and 60s and 70s, that was not the case. So I like to say that the people who criticize the idea of reforming healthcare, that we cannot let status quo won't work. And the president has said this over and over again. And even people who went to the original meetings in the White House from the insurance industry and the pharmaceutical industry said you're right. So there's general conclusion the status quo won't work. The insurance industry said that they would come up with a plan that would save $200 billion within 4 years. I don't think that's enough. So that's the sort of the scenario why we have to have health care. And in my view, doing a public option, but getting some of the waste out of health care. So where is the waste? Well, a lot of the waste is in products that the insurance industry has introduced to the market, not all of it, but of the $2.2 trillion that are in healthcare costs in the United States as a whole, about 30% of that is insurance costs. That has gone up from when we were all younger, from about 10%. So it's 20% increase in products related to insurance. When that originally started under managed care, that was sold as that was going to start controlling the cost, and the opposite, unfortunately, has happened. So we have to look at that. We have to look at pharmaceutical costs, and we have to introduce generics into the marketplace. So if somebody develops a really good product, you're allowed a certain amount of time. It's the American system. You did the research and development, you came up with a really good pharmaceutical product that works, you make money off of it for a period of time. And then it becomes a generic product that's public for everyone, so that if you can do it better and more efficiently, you continue to make money off of your idea, but then there's also cheaper costs out there. And then we have to deal with, I think this is really important, is we went to a fee-for-service plan where very costly health care, which is very effective, like Diana's husband's hip replacement, which is a wonderful thing that you couldn't do 30 years ago with any level of success or worry about losing your life. So those are good things, but they're expensive. So if you look at, Kaiser does a good job of this. If you get young people into the pool, and the idea of the general practitioner, your family physician, who you pick, and has basically control over what your health care is going to be, which is the case under the Obama plan, then that person is caring about you and your family, about making you healthy rather than giving you products that are expensive. And we have to introduce that into the marketplace. So when I was growing up, Dr. Casey was our family physician. My 4 brothers and sisters and my parents went to Dr. Casey. He was the gatekeeper of our health, but he was also the gatekeeper of costs. And basically, we have to go back to the future. We have to go back to that model in America where you could go to your own family physician who you trusted, you knew, you had a personal relationship with, and they could tell you what they thought was best for your health care, for you and your kids. But we need to start with young people because they need to pay into the system and they're the least costly. And to be perfectly honest, just like in retirement, if you do an actuarial study, you have to have young people paying into it as part of the social contract with all of us as we get older. So we can be assured, I thought John Garamendi had snuck up behind me here. So we can be assured that young people who are working are participating in Social Security, helping subsidize Medicare, and helping subsidize the healthcare system, so that when they get older, it's the same social contract that generations provide for others. And then let me finish on just a couple of statistics that I think should alarm all of us about healthcare in the United States. I believe, in my political life, is that the number one thing for me is to leave this place a little bit better than when I came into it. We all try to do that. We are about to give to the next generation of Americans, for the first time in the history of when we recorded life expectancy, a shorter life expectancy than our generations had. So it's actually going down. That's not right. We all benefited from our parents and grandparents working hard, and our life expectancy went up. The opposite is the legacy that we are going to give to kids. So we have to change that. And some specific examples of this: obesity in the United States has doubled amongst adults in the last 20 years, and it's tripled amongst young people in the last 10 years. So the Center for Disease Control has done wonderful studies, and this is a wonderful sort of example of where we need to fix healthcare. We need to go back to make sure that kids are getting exercise, are getting the right kind of nutritional, dietary help, so that they will be healthy, so they can provide for us and have a full life. And then when they get to be older, they can have a life expectancy that's actually greater than the ones that you and I are all fortunate enough to experience.